Hi, I'm Dr. John Chessare, the President and CEO of the GBMC Healthcare System, and I'm here to bring you our bi-weekly update on the coronavirus pandemic. So as you've seen with the governor on television frequently, we have a new surge of coronavirus infections in Maryland and in the country and at other places in the world. It should be no surprise to anyone that as the temperature changes, people turn indoors, that the opportunity for transmission of the virus goes up and we see more cases. So we now have more than 1,100 people in Maryland hospitals who are COVID-19 positive. At GBMC, we have 33 people who are COVID-19 positive, which is close to our highest since the pandemic began. Subsequent to the governor's mandate, we have stopped allowing visitors to patients in our hospital. There are some exceptions, people with disabilities, people delivering babies, and end-of-life issues, but for the most part, no visitors will be allowed in our hospital. This is a difficult move for us to take, but it is very important for us to try to stop the dramatic increase in the number of COVID-19 positive individuals. Now, Thanksgiving is next week. I will be having Thanksgiving with my immediate family. We will be very cautious. We will be washing our hands frequently. We will be working to stay socially distant, even though we are living in the same household. I would ask all of my fellow citizens to be very careful during the holiday season. If you can, celebrate out of doors. If you must move indoors, please keep the numbers down. Please wear your mask. Please have people washing their hands frequently. This is the only way right now to prevent the spread of disease. What about the vaccines? Well, since we last spoke, there's been more good news on the vaccine front. There's an AstraZeneca vaccine that is in phase 3 trials that looks very promising, and both the Moderna and the Pfizer vaccines look like they're going to be in the vicinity of 90% effective. We are hoping that those vaccines become available to start giving to the population probably just before the end of the year or early in next year. GBMC is working closely with the Maryland Hospital Association and state officials to be ready to distribute the vaccine when it gets emergency use authorization from the Food and Drug Administration and gets a stamp of approval from the Centers for Disease Control. Again, the scientists at those two agencies will not let the vaccine be distributed until they are sure that it is both safe and effective. And as I've said, I will be the first in line when it comes my turn to get the vaccine. So you may want to talk about the vaccine at your holiday gathering because there's fear out there by people who don't know the facts, and we have to help them learn the facts to allay their fear, because a vaccine that gets into production that only 50% of Americans are ready to take will be helpful, but not very much. We need more people to take the vaccine when it is their turn. And again, we will start with first responders, police, fire, EMTs, doctors, nurses, and other clinicians working in emergency departments, in intensive care units, and in the rest of the hospital will go first. After that, elders and people with chronic disease will go next because they are at the highest risk of serious negative outcomes from the disease. And then lastly, the rest of the people in the population. How long will that take to immunize all Americans? I'm not sure. It will take months, but the sooner we get started, And the more people willing to take the vaccine, the faster we will get to the end point, which is the end of the pandemic. And that will then give us the opportunity to back off of social distancing and the wearing of masks. So I want to thank all of you, as I always do. Please keep up your vigilance. Let me thank the healthcare workers once again as they are standing up to this second surge. And please stay safe. I hope to see you soon. If you need care, we are ready for you at GBMC.